All right, this video will be a review for your exam for tomorrow on abnormal psych and treatment. All right, at the beginning of this unit, we looked at the fact that you need 3 different criteria to be present in order to be diagnosed with a mental illness. First of all, the behavior one exhibits must be deviant, meaning it has to be unusual to the norm or bizarre. The second criteria, it must cause the person a lot of distress. So meaning it causes the person to feel anxious, worried, apprehensive. And if those 2 are present, we could say that one has a neurotic disorder, meaning that they have a problem or a mental illness, but they know they have that issue, like an eating disorder, such as bulimia. So someone who eats large amounts of food and vomits, that is deviant or unusual behavior. It causes the person a lot of distress and worry because they're continuously worried about body image and weight. However, they know they have that problem. If the third criteria comes in, we say that that is a psychotic disorder. So this would be dysfunctional. And if someone's behavior is dysfunctional, it means that they've lost touch with reality. What is going on in their mind is very different than what's going on in others' minds. For example, schizophrenia. Someone who is suffering from schizophrenia will have hallucinations and delusions. So they see and hear things that don't exist, but they are very real in their minds. So they've lost touch with reality. We looked at the history of mental illness and how people perceive the mentally ill throughout our past. And we talked about ancient times and the Middle Ages. It was often thought that either the gods were controlling behavior, or it could be that there were evil spirits that were controlling behavior. And the treatment of choice would have been to bring in a priest for exorcism. However, most historians believe that the early exorcisms that took place were not actually people who were actually demon possessed, but actually mentally ill. Okay, you need to go up. All right, so we looked at the medical model for Philippe Pinel in France. He was the first to decide to transform mental institutions from housing of individuals where they were chained and put in cages. So he believed that we can actually diagnose people, treat people, and possibly cure them of their mental illness. So that is the medical model. Again, that was Philippe Pinel in France. We don't see that transformation here in the United States until after the Civil War, and that would have been Dorothea Dix that did that here. All right, we talked about different anxiety disorders. You'll see a question that will say, which of the following is not an anxiety disorder? So you'll need to know them. First of all, PTSD, which is anxiety due to some traumatic event, and through flashbacks or nightmares, one still experiences the anxiety when they think of that traumatic event, whether it would be abuse or it could be a soldier in combat. Those are the 2 most common or prevalent examples of PTSD. GAD, or generalized anxiety disorder. This is a chronic, ongoing anxiety where one experiences anxiety, worry, and dread on a daily basis, over and over and over again. I don't have panic attack up here, but that's acute. That's just experiencing anxiety at various points, maybe once a week or once every 6 months, but it comes and it goes and it tends to fade over time, whereas GAD is chronic, ongoing, day after day after day. Obsessive compulsive disorder. So the anxiety One experiences with OCD, they have unwanted thoughts or obsessive behaviors, most typically dirt and germs. So you feel anxiety as you think about those, and that causes you to engage in some sort of ritual. So that is the compulsion. And with dirt and germs, that's usually washing your hands or bathing. So the anxiety goes away briefly, but then it comes back, very cyclical. And phobia, which is an irrational fear of most typically a specified behavior, such as heights or spiders or snakes. All right, we looked at mood disorders, the two most common, major depressive disorder, which is feeling sad, lethargic, losing interest in things that you used to like. There will be a disturbance in your sleep as well as appetite. You want to associate depression. Many people suffer from depression because they have low levels of serotonin. So antidepressants that one would take just simply boost the serotonin levels to make you feel better. Bipolar. So bipolar disorder is characterized by shifts in emotions. So one experiences the symptoms of major depressive disorder at times, and then other times they will have a feeling of excessive energy or euphoria or mania. And lithium is the drug of choice here, which is a mood stabilizer to keep the serotonin levels from going too high and too low. Two personality disorders that you need to know for your test. Antisocial personality and avoidant, which a lot of people get them mixed up. Antisocial involves somebody who is very irresponsible, often engaging in negative behavior, and feels absolutely no remorse for what they've done. They have no empathy for others. They can harm others, and it doesn't matter. Two types of antisocial behavior would include a sociopath and a psychopath. The avoidant personality, that is someone who is very shy and avoids social interaction with others.
So he did the integrated one, but not the algebra one.
He's up there now.
Yeah, but he's coming back down to take it, and he needs to give you his stuff.
Okay. Okay, so we looked at schizophrenia. Schizophrenia has two different types of symptoms. Some are negative, some are positive. The positive, first of all, this is having some type of symptom or behavior in excess of what normal people exhibit. So a lot of people with schizophrenia, they have delusions where that's like a storyline that they're playing out in their mind, like the FBI is after them or aliens are after them. Second positive symptom would be hallucinations. So seeing things, hearing things, feeling things that aren't really there. A lot of people with schizophrenia hear voices, many of which are very negative, telling them to harm others or themselves. Disorganized thoughts, so that could be like a flight of ideas or bizarre thoughts, saying like the picture has a headache, which wouldn't make sense. Unusual actions, such as pacing or twisting their hair or rocking. Negative symptoms. So a lot of people with schizophrenia will lack facial expression whatsoever. So you would never be able to tell if they were happy or they were sad. And many of them experience catatonia. Oh, not many of them. That's just another negative symptom. That's actually rare. So that would be frozen in usually some awkward position. All right, cause. Again, they're looking for a gene because we find that it does run in families and through twin studies. If one twin has schizophrenia, the other one has a high probability. But there's a strong case for connecting schizophrenia to the person's mother having a virus with a high fever while they were in the womb, specifically during the second trimester when the nervous system is developing. right, finally, we looked at dissociative identity disorder, which is usually caused by abuse. 95% of people with multiple personalities suffered abuse as a child. So they begin to dissociate while the abuse is occurring, starting to imagine that they are someone else, somewhere else, and eventually that envelops into a specific personality. All right, to finish up, we're going to look at treatment. So first of all, remember, psychoanalysis involves we have irrational behavior because of some unconscious thought we're unaware of, or some early childhood experience. One technique that a psychoanalyst would use is free association. So having the person say whatever comes to mind and then writing it down and analyzing the behavior to tell them what is actually going on that they may be unaware of. A humanist believes that if we improve our self-image or self-esteem, that will help us start acting more rational. They use active listening, which is a form of client-centered therapy, which is complete opposite of psychoanalysis, where with free association, the therapist is very critical and judgmental and telling you exactly what your issue is that you're unaware of causing your behavior. With active listening, you just simply listen to the person talk, you rephrase it, you echo it back, and somehow that makes the person aware of their issue and they can resolve it on their own. With behavior, it's not your childhood experience or your unconscious thought or your self-image or self-esteem causing the behavior. It's simply the behavior is irrational, so you need a counter conditioning. You need to be trained on a behavior that can replace it. So they use, first of all, exposure therapy. That's with phobias. If you're afraid of a phobia or you're afraid of some specific thing, let's say heights, they want you to be exposed to it over and over and over again. And that will allow you to become used to it and become desensitized. So systematic desensitization is a form of exposure, but you are providing the exposure in a very relaxing environment and also using small steps. So you wouldn't want to take someone in a first session who's afraid of heights up on top of a skyscraper. You'd want to do it gradually, moving up. Aversive conditioning, think of aversive as unpleasant. So you're exposing someone to something unpleasant to stop a behavior. So let's say you have a child who is using a pacifier and they need to start school, so they need to give it up, but they don't want to. So you may dip the pacifier into something they don't like mustard or vinegar or something that the child dislikes. That's aversive, unpleasant, and that will stop them from using it. So changing the behavior. A token economy. This is behavior modification where you want someone to act more appropriately. So you give them some type of reward for engaging in good behavior. And eventually that's supposed to promote better behavior. So think of like the treasure box in kindergarten. You do what you're supposed to do and you're good behavior on Monday. On Tuesday, Wednesday, and Thursday, you get a check mark all 4 days, and then Friday, you get to pick out of the treasure box. So all of those represent types of counter conditioning. Group therapy. Group therapy can be very beneficial for someone who has a mental illness because you're in a session with other people who share the same problem that you have. So it's nice to know that others experience the same difficulties that you have. And also you maybe can learn what strategies have worked for others who have that same mental illness, and that can help you with yours. itself. 3 different medications that we looked at. I already talked about lithium, that treats bipolar disorder. That is a mood stabilizer. Xanax and Ativan are anti-anxiety medications, so they treat all of the anxiety disorders that we looked at. And Haldol, you may see that's an antipsychotic drug that specifically treats schizophrenia. All right, so that is everything that you'll need to know for your exam tomorrow in regards to abnormal psych and treatment.